Well, it was to the point where he couldn't take the trash out anymore. He couldn't go up and down the stairs. We live in a 3-story townhouse, so the stairs were impossible. And if he forgot something, I had to go upstairs for it or downstairs for it.
Every time I walked, it hurt. Going up, I had to use a banister to pull myself up the stairs. I couldn't stand very long at receptions. I would wait for people to go up the stairs before me if there were some stairs to go up, and I'd pull myself up as quickly as I could. Same going down the stairs. Just walking was difficult. The pain got to be to the point that we knew I had to do something. And then when friends of ours had used Dr. Lewis, and we went to see him, and he showed us the x-rays where there was no cartilage left in the knees, I felt worse leaving than I did walking in when I realized what was wrong. And then he said, "I don't believe in pain." And I said, "You're the one. I will have my knees done."
We saw Mr. Thompson, who had 2 knees done a week apart and was the recipient of excellent anesthetic management and went through having both knees done about as easily as it's possible to do. He's told me on multiple occasions that he had no pain. I can't say that I believe that he never had anything that bothered him at all. I think that people will have some discomfort. But the kind of pain that was characteristic of this operation is, as far as we're concerned, now history. And you can see how well he's done and what a difference it's made in his life. And I think that that's true of the people who need knee replacement. That it is really, for many of them, regaining their independence and a style of life that they had lost because it was simply too painful and difficult to walk.
For a total knee, we're going to take steps that will prevent you from having pain after surgery and ensure that you have a safe, comfortable anesthetic during. What might happen is that after you are interviewed by the entire team, you will be taken to an area where we will get you ready for surgery. We'll probably offer you some sedation and make you comfortable and relaxed, after which we're going to place a couple of nerve blocks. A nerve block at the very front of the leg, that's called the femoral nerve, that will make the front part of your knee numb, and a nerve block at the very back of your leg that will make the back of your leg numb. This is accomplished very quickly in about 20 minutes with minimal discomfort to you, and most patients actually sleep through it. When you wake up, you will not be feeling the effects of the surgery and will simply ensure that things are smooth before you go to your room and start your rehabilitation that very day.
One of the things that's different about the way we've been managing the rehabilitation and the patient's pain around the time of surgery and during rehabilitation is that the block is not just given for the time you're in the operating room or the immediate post-operative period. A small catheter is placed alongside the femoral nerve, and for 2.5 days after surgery you continue to get some anesthetic which gives you some numbness in the leg, but basically is just very good pain control. This pain control means that you can start your rehabilitation, begin to make progress immediately after the operation. By 2.5 to 3 days afterwards, you won't need this anymore. You'll have achieved a large proportion of the motion that you need to have a good result, and as you get your strength back, you'll find that the block basically has taken away that very bad pain that was characteristic of the way we used to have to do this.
Every time I moved before, it hurt. And that's not the case today, and that makes all the difference in the world. And I had postponed the surgery for a couple of years because I didn't want to go through that excruciating pain. And I was more than surprised because it just wasn't there.